Disclaimer, this is not for anybody else's treatment. This is my treatment. But I wanted to talk about what I do specifically because it makes a difference. Like, I do not get so depressed and anxious and have horrible problems with suicidality except if I don't treat it. So I can usually stay at a level that is at least somewhat manageable with lots of support, lots of help, lots of treatments. If not, it's really bad. So, that's not for anybody else's treatment though. So, what I do is I have acupuncture. I have an acupuncturist who specifically works on my hormones. So, she specifically works on balancing my body, but especially balancing my hormones. And so, she does certain points. I do it every week. That's hard to do. It's expensive. It is so worth it for me. She helped get rid of my cramps. I used to not only have horrible PMDD, I also used to have horrible cramps once I got my period. And so I would just be lying in pain crying. So the whole thing was, the PMDD led up to it and then it was just horrible. And then I would start to get better. So the cramps were horrible, especially like the first or second day. So I started seeing her and she really helped with that. I literally have almost no cramps anymore. So I knew it was helping. So I've kept doing it. I stopped for a couple years, but then I started up again a year ago. And partially it was, one of the reasons was because I was still having problems with getting suicidal. So I do the acupuncture. I have tried multiple supplements. I've tried evening primrose oil. I've tried Vitex or chaste tree berry. I've tried, tons of things. And I do still take vitamin D and do a lot of things that help with everything, but especially keeping you in balance, I eat a certain diet for my Lyme disease, but it is helpful for everything because I have way less inflammation and I am just more balanced and healthier. I don't eat any sweeteners except stevia. So my blood sugar doesn't go like that. And so for me, those things make a big difference. So food, acupuncture, certain supplements, like I said, I've kind of gone through a lot of different ones and they never made a big enough difference. Like I didn't even notice it usually. So that was just not something I kept doing. If you have milder PMDD, and I don't know if that really exists, but if you have PMDD that can be helped by, different supplements, treatments, or herbs. I've tried Chinese herbs. I've tried everything I can get my hands on. I've tried PMS tonics, different herbal combinations, everything I can think of, and everything everyone else around me can think of, because I have some people who are very skilled herbalists, and we've tried it, and so I don't take many supplements anymore and herbs. I take a few. The main things that have helped and that are super important are meds and hormones. So hormones, supplements. In this case, it is a prescription hormone, but it's because it's not like a gel or cream. I actually take the pills. So, but it's bioidentical progesterone. So it's different than taking synthetic hormones like birth control. So I have tried birth control. I have tried monotherapy birth control, which means that it doesn't go up during the month. Like you don't have changes in your hormones, what you take. The thing I had with that was that I tried to do continuous birth control. And so because I was trying to level out my hormones. So I did birth control where you like I said, you don't go up and down with different hormones throughout the month. You just take the same stuff. And then you even take it during when you would have your period to try to stop your period. Because that was like something I couldn't do anymore. I couldn't have my period without having the terrible PMDD. So I was trying to get rid of the PMDD. So I was trying to get the hormones like totally flat. And that's even questionable how good that is for you, but I just have to do what I have to do at this point. And so for me, the hormones, the problem is after about 3 months, you have to have your period. So then it would be like so awful again. And sometimes I was having lots of other problems with bleeding in between them and stuff like that. It helped. I tried like other birth control and it kind of helped. I tried the Nuva ring. I tried like maybe 3 to 4 kinds. Then that didn't work well enough for me. I didn't feel. I still was having major problems. So I've tried to go to gynecologists. I've gone to my epilepsy doctor doesn't want to treat my hormones, even though they basically intensify and practically cause my seizures every month. I've tried to go to a women's health psychiatrist. I've gone to women's health herbalists. I've, and I do things like meditate every day, stuff like that. So the hormones have been a big part of it. Now I take bioidentical progesterone. That is something that has been really helpful. I take it after the 2 weeks, I start taking it. And then the week before my period, we double it. And so I still have my period, but the amount of progesterone tends to be seizure reducing and estrogen tends to be seizure increasing. So that's a big part of it for me because like I said, when I have more seizures, I tend to get into confusion and sometimes psychosis. And so already from that, and like I said, but it's also really exacerbated by that PMDD. So it's all together for me. And so the progesterone really helps. I do take it just 2 weeks. I do take it at different levels because otherwise I still have the terrible PMDD if I only take a certain amount and then I have to up it and then I get my period. And if I don't, at this point, I still have all the major symptoms as well as more seizures. So it's reduced my seizures even. That's the main thing I've done to try to treat it, which I was the one who came up with the idea because I've tried everything with all these different doctors and stuff and they have no good solution. And so for me, I was like, okay, let's try this kind of hormone. Let's try, like I said, I was like, let's try birth control. Let's try continuous birth control. Let's try, all of it because I can't do this. And so I also now, once I started getting really suicidal, because it happened every month, and I talk about that in my other video about PMDD and suicide risk. But with me, it got so bad that I just didn't care anymore, and so I did get really suicidal and actually planned to commit suicide. So that's not okay. And so after that, I decided to get on antidepressants. I should have gone on them for myself a lot sooner, gone on them, because there's no point in waiting until you're going to commit suicide. So I got on antidepressants. That ups everything to a better level. Like, it keeps me from going, like, down to rock bottom. So it keeps my depression level at least better, even if it gets worse in PMDD. It's still, like, up a little bit, rather than just, like, and so for me, the hormones and the acupuncture and then the antidepressants, and I actually up my antidepressants the week before my period. So I take it throughout the month. I do because I really need it. I take 3 psych meds, and I won't get into what they are, but I take a mood stabilizer, I take 2 antidepressants, and they're different kinds so they don't interact. But anyway, then the week before my period, I have an as needed anti-anxiety med, which is really important. I try not to take it because when I get PMDD, I start getting weird about, like, I don't want to take that. I don't want to take more stuff, and I'm, like, miserable and a disaster. And so, like, my therapist will be like, why don't you just take your anti-anxiety medication? And I'll talk to her and we'll deal with it that way too. But I need to take more stuff. Like, I have to take more meds the week before my period or I'm a mess. And so for me, it's like all of it. I have to do all of it. And for me, the symptoms, which I have said are the major depression and the anxiety and the seizures, I take 2 seizure meds. I'm still trying to get rid of all the seizures. One of the main ways I'm trying to do it though is by trying to get rid of the PMDD. So, like I said, all these things are important, and diet and everything. And so it's like vital to treat it however you can. And the reason I say my treatments is because I have tried so many things. And to find anything that even in combination helps and keeps me from being suicidal every month is totally worth it for me. So I wish you the best. If you think any of these treatments might help you, talk to your doctor about it, because they might not come up with them. They might not say, let's try this or that. They might just say, oh, you have severe PMS, and leave it at that, and that's not okay. And you need to treat it if you can't stand it. I wish you the best.